national policy in place, okay? And that's what we were saying. After the national policy has been put in place, remember that one is supposed to now align the health sector with the new constitution.
Yes.
So it was supposed to come immediately after enactment of the constitution.
Yeah.
After we have the health policy, now we formulate health laws, which are in line with the health policy. Now, once we have the health laws, and this is even provided in the laws of the country. If you look at the Transition to Devolved Governments Act, there is a provision that before you transfer any service to the county, there must be a law in place. So health policy first, health law in place, then you transfer the services.
Yeah.
What we did with healthcare in August last year is that we started with the tail.
Yes.
We started by transferring the services to the counties. And then now is when we are grappling, trying to formulate a health policy. And what I have seen is that this policy is being formulated so that it aligns itself with what has already been done.
Right.
And that is now missing the point, because we are doing things wrongly. We are now doing them upside down.
This is complicated. We want to hear what the public thinks. Of course, there's a lot of feedback. You know, there are people who agree with you, others who don't agree with you. Let's see, Kirigo, what does the public think about the resignations and what Dr. is saying?
Yes, David, quite a number of SMSs coming in. Remember, you can join into the conversation, 22422. I'll read a few that I've been able to select. There's John, an affected doctor, who says, in Elgeyo Marakwet, some doctors were demoted, transferred, and some threatened up to date because they belonged to a particular tribe. Can we talk about that? That's John, an affected doctor in Elgeyo Marakwet. Then Anonymous, Makali and Mutegi, the situation is worse than you think. When we exhausted theatre oxygen, we were told, and I quote, why buy oxygen when it's floating about in the atmosphere? It's wrong to devolve health services. Then Anonymous here says, Dr. why are you painting a picture of hospitals we have never known? Let us be honest. They're not happy about close supervision. They want to be free to earn salaries and operate in private clinics. That's from Anonymous, sorry. Then there's someone here from Uganda who says, Makali, why are the doctors, why is it doctors are the only ones complaining just because they don't want to work 168 hours in a month just like other civil servants? Let them resign and we get other doctors. That is Anonymous from Uganda. Remember, you can join the conversation, 22422. Tell us where you're writing from. Don't forget to include your name. David and Mutagi?
Yeah, well, that's very, you know, I would say indicting, but also sympathetic messages there. Let's see what you think about that.
Actually, when you hear some of that feedback, especially from the affected members, it is worse than you think. Because when we sit here and we are talking, we are not experiencing that first-hand experience that these officers are having within the hospitals. I can tell you without fear of contradiction that it is a very traumatizing experience when you see someone walking into the hospital, a mother carrying her child, and you know that this child is supposed to go back home well, because the condition that this child has is very easily treatable. But because you don't have, for example, some very simple equipment or maybe supplies that will allow you, maybe this child is just having diarrhea or vomiting, and you just need to rehydrate and they'll be okay. But because you just don't have even maybe the giving sets and the granulars and maybe the fluid that you need, then you see the child, you watch them dying on you. And probably you also have to go back and start lying to the mother that there is nothing that you would have done. That time she's wailing, she's crying, she's going back home empty-handed. It is a very traumatizing event. We see worse things than those ones. And when the doctor goes back home in the evening, they are traumatized.
Yeah.
Now, the people who don't experience it, they actually come back and start saying, no, these doctors are just, you know, why is it that they are the only ones complaining? They don't want to be supervised and things like that. But in the actual sense,
yes,
it is a very bad situation. That's why you see quite a number of doctors even end up becoming alcoholics, and people are wondering, why are these doctors alcoholics? Why are they being put into institutions, mental institutions? Because of what they are seeing every day. It is worse than you think. But you know, when you are outside there, you can easily start, like the way the politicians were saying, you can easily start saying, no, they just don't want to be supervised, they want to go and run their private clinics, and so on and so forth.
I don't understand why these things, why does ethnicity, where does it come in? Because a doctor is a doctor. Whether you are Kalenjin or you are Kikuyu or whatever, when you are in a hospital, you are a doctor. You are not a Kikuyu. You are not a Kalenjin. You are not a Luo. Why is it that people are being told you cannot work here because you are not from here? Because a doctor is a doctor.
Now, Mutegi, those are the things that that are really puzzling us today. Because go to the counties today, and you will see it. You know, much as we are wondering what is happening, does this disease identify the ethnicity of this doctor?
Yeah.
But you find that it is actually what is happening. People are being fired. We know of counties where even very senior doctors have been fired because they don't come from that place, because they are in administration. They are in administration. Then natives of that county are now made the administrators, so that they can now be in charge of these very senior and experienced doctors. Of course, how do you expect now such a doctor to start working under? You know, it is not possible. The environment becomes very difficult, because this is your junior. He's giving you wrong instructions, but just because he comes from that ethnic background, now that becomes the qualification for that person to become the administrator. And it is rife. It doesn't have to take us sitting here to be able to bring it out. All you need to do is just to visit some of these hospitals and see what has been happening, and the ethnicization is extremely present.
What do you recommend in this whole mess of, you know, basically it's a crisis, administrative, you know, equipment, you know, stocks of medicine missing and so on. And what you're talking about, ethnicization of appointments that offend professional hierarchies and seniority. What is the recommendation of KPMDU?
Okay, I think as a union, we have done quite a bit in trying to voice this concern. And we started talking about it earlier, because the nature of the services we give is such that you cannot really wait. I know that maybe our system likes waiting for the crisis to happen before they now start running, waiting for the horses to bolt before they close the gates. But the nature of our services is that we really need to find a culture where we can anticipate the problems and forestall them. Now, unfortunately, as a union, when we tried to do this, a lot of politics came in, and it looked like we were just, you know, we were just raising red flags for no good reason. Now, the ball is squarely in the court of the government. You are saying that this is a crisis. The crisis has not yet begun.
It is going to get worse.
We are staring at a total collapse of the health sector in this country. And when that one happens, now is when you will know what a crisis is. Because right now, we are watching, some people are still trying to say, let them go, we will hire others. You see? So it has not yet.
I heard that from Dorothy Nditi, the acting governor of Embu,
but
which suffered the first departures.
What do you expect from Dorothy Nditi? She's a governor. She earns over £1 million in a month.
That's not true, though.
And when her children fall sick, she can afford to take them even to America for treatment. She takes them to the private hospitals. But the common mwananchi who depends on the public health system cannot afford.
Okay, let's talk about this thing of supervision, because it's key. I mean, this function has been devolved to governors. Governors must be answerable for healthcare in their counties. They should have a hand in what is going on. How do you propose that be handled?
Okay, supervision.
If doctors are not resisting supervision, because clearly there is a problem there.
Definitely, and I want to be very clear on this. We will have to define what kind of supervision we are subjecting these doctors to. Because even our regulatory mechanisms, there is a regulatory board which is charged with the responsibility of supervising the professional conduct of these doctors. So if it is anything to do with the professional supervision, then there is a system that has to be followed. Actually, if it is, say, supervision in terms of payment of salaries, I wouldn't even mind, even if it is the village headman who is given the salaries to pay, so long as he pays on time and he also pays the right amount and he doesn't use it to try and intimidate the doctors. But when this village headman comes and tries to tell the doctor, now this procedure you will do it this way, and yet he doesn't even have
No,
any
I
idea.
think it's not going to that extent.
What,
It is going to...
but that is what we are
Dr.
seeing.
The problem here is the doctors are not keeping working hours. That's a persistent problem across the country.
And
the doctors are preferring to go to their clinics, private clinics. They're keeping few hours in hospital. So the county government must be interested in seeing that this is not going on, because they need the sick people attended. It's the function.
Okay. I think that is a very wide area, and I don't blame you, because you don't understand what you are saying. However, there are some doctors who do not work the recommended hours. But I will start by asking you, how many are the recommended hours? Because most of the doctors work way beyond even the globally acceptable hours.
Right.
What the general public thinks is that a doctor should be in hospital 24 hours, 7 days a week. Okay? And we have seen that happening.
Not so. Let me clarify
excuse
what I, as the public, expect. I expect that there will be a doctor on duty in that hospital.
Yeah, then the hospital
There
has
could be 10
only...
doctors, so they take shifts.
No. The hospital has only 2 doctors or 1. So you, as the public, you expect to find a doctor when you go there.
Yes.
The government, in its role, is supposed to ensure that doctors are available. Now, what we are seeing is that the doctors are very few. By the way, you know, we are less than 3,000 in public sector, when we need a total of about 40,000. If you want to be finding a doctor every time you go to the hospital, we need to have at least 40,000 in the public sector. So the ones who are there, they end up working for over 160 hours a week. So that the moment they leave, maybe to go and rest, or maybe to go and also look for one or two other things, because they are human beings, now that is the time people start saying, these doctors...
What are the hours?
Just a minute.
How is it?
Just a minute.
Yeah.
Just a minute.
Okay.
These doctors are always missing, because to you, it is going to be important at the time you come with your patient and you find that the doctor is not there and your patient dies. Now you'll say doctors are never in the hospital. Okay? Now, look at it again this way. The pay. Because I know there are some who maybe work for less hours than probably is prescribed.
Yes.
The pay that you are giving this doctor, is it commensurate with the kind of work that he's doing?
But the point is, he took up the job on that pay.
Now,
why would he take up the job and then abscond the duty?
Taking up the job is one thing. What are the requirements probably of the employer? And I can even give you specific examples, but I know that maybe we might not have enough time to do that, such that it becomes up to you to choose. Do you need the services, especially of those very highly specialized doctors, the subspecialists, who are being highly underpaid? Do you need their services, even if it is for a few hours, or you don't need them at all? Okay?
Right. Okay.
So you'll find, if you want their services for all the hours that you need it, you need to pay.
Pay them more. And there's a problem with pay.
Yeah, but now, because you're not paying, sometimes you have to allow these highly specialized doctors to either carry out those duties and probably
externally,
so that they can be able to also provide these services.
That is not the case, Dr. Ari. That is not the case. In the local situation in a district, where you have 2 doctors or 3 doctors in one hospital, if you want to see them and get treated, you first have to go to their clinic. How is it they find time to go to the clinic? And they are working all those hours we have described. If you want to see a doctor and get proper treatment in the general hospital, you go to his clinic first to pay some consultancy, then he'll take you to the bed in the hospital.
No, that is not the case. Huh? That is not the case all the time. Once in a while, there could be some cases where there are arrangements for, you know, these highly specialized doctors. No, Mutegi, let me tell you. You know, the problem with you is that you are being very highly subjective, and you are looking at maybe some aspects of a situation without looking at it globally. Because you might find a doctor is running, a clinic, and he's a very highly specialized doctor. Maybe he's a subspecialist, an orthopedic surgeon, and he has to see patients. Excuse me, Mutegi. Excuse me.
Where do you get orthopedic surgeons in
Mutegi, now, you see, you are pushing down something which you are trying to skew, so that you bring out a certain point. But the truth is, the situation you are describing, sometimes you have to find someone whose service is very scarce, providing for several hospitals. Okay? And how do you manage to have this person seeing patients who need his services in all those hospitals.
That one I agree with you.
Okay.
But
You have to find out. You have to find a
town,
formula.
In every town where there are doctors and where there's hospital, all of them have clinics in the town.
Not all of them.
Most of them have clinics in town.
Okay.
And they are not GPs.
No, no, no,
They are
no.
general practitioners.
No, no, no,
Some
no.
of them
That
are
one-
even clinic officers.
That
are
Clinical officers working in the hospital.
Yes, they
not
are
even
some.
doctors.
Now,
not even
Mutegi.
doctors. Clinical officers, doctors, they have
Mutegi.
clinics in town. So
Mutegi.
when you want to service in the hospital, you have to go there first, then they take you there.
Mutegi, the problem
That's
with
it.
you is
That's-
that you are generalizing
No.
maybe one situation